Good afternoon, everyone. Welcome. It's wonderful to see so many of you here. I think that really shows that gender and gender mainstreaming is really becoming increasingly something that global health actors and development actors are taking more seriously. So thank you all so much for being here. We will be recording this session as well, so if you have any colleagues who would like to follow this afterwards, we will be providing the streaming link after the seminar. I will just hand it over to Dr. Kate O'Brien, the Director of Immunization, Vaccines and Biologicals here at WHO, and she will be introducing the panel members that we have today and talking a little bit about the agenda and why we're all here. Thank you, Kate.
Great. So welcome, everybody, to this lunchtime seminar. I'm delighted to be here. I'm glad to see everybody else here as well. And I think this is being recorded. Is that right? And do we have some people listening in as well? Is it being...
There's no one listening in at the moment, so it's not WebEx, but it will be a streaming link that then there's video and audio recording.
Great. So this is going to live in perpetuity.
Yes, exactly.
Okay. And I think we have it. How do we advance the slides?
I'll have it.
Great. Could you go maybe to the next slide? Yeah. So just I'd like to give an overview of the seminar and describe a little bit about what we're trying to get out of this, and then introduce who some of the speakers will be. So this is really about sort of looking at the current WHO vision, strategies, and priorities in gender mainstreaming, and the why, the what, the how of how this has happened in the Polio Eradication program. And then really trying to get out of it sort of practical tools and the resources that are available for other programs to take on board and advance the efforts in this area. So this is supposed to be a discussion about sharing and learning and what action we can actually take. So in terms of sort of how we'll go through this, we have 3 speakers, and then there will be time for question and answer and discussion. So let me just sort of introduce that. So the first speaker will be next to me, Diah, Saminarsih, who will talk about the current WHO vision and priorities in the sort of gender mainstreaming area. It was intended for Michel Zaffran to be here, the Director of Polio Eradication, but because of a personal emergency, he couldn't be here. So instead, and standing in his shoes, is Daniel Walter, the Chief Operations Officer. So thanks for at the short notice stepping in. Really appreciate that.
It's a happy surprise.
And then the third speaker will be Veronica Magar, who's the Director of Gender Equity and Rights at WHO. And her topic is going to be around the tools for change and sort of an overview of the resources to support gender integration across WHO. So we're going to leave plenty of time for questions and discussion at the end. And really the point of this seminar is for exchanging experiences and lessons learned so that other units can also get inspired for what we can do in this area. So can we go to the next slide? So why gender? And probably just to sort of, everybody here has some notion of why gender, otherwise you probably wouldn't be in this room. I think what's really important as we head into this discussion is to really focus on the idea that this is not about women. This is not just about, sort of women having issue in this area, although it's very often understood that way. It's really much more about understanding the ways in which our gender roles, the norms, the relations, impact our access to services, certainly vulnerabilities and challenges that are faced in actually accessing those services. So we want to explain sort of bringing another lens to looking at this issue of access to care. And the second reason why we're talking about this, apart from its effect on health outcomes, is a very clear increase in the focus from donors on addressing this. So this is also something not just that we should do, it's really something that we're going to be increasingly required to do. And so we need tools here about how we're going to incorporate these questions into the work that we do. It's ultimately about equity, it's about gender equality, and it's a human rights issue. So insofar as this is a core sort of UN value, we're accountable for delivering on this, and it's a component of our program effectiveness. So I think the importance, and I suspect if we went around the room, we'd see a large number of people across different sectors and groups and sections, and I think it's also recognizing how this is really sort of intersectoral, if that's a word. So I think rather than making any more comments from my side, what I'd like to do is to turn it over to you, Diah, as the first speaker, and sort of introduce the sort of gender mainstreaming now and the current WHO vision, strategy, and priorities. So over to you.
Thank you, Kate. And hello everyone, welcome to the lunchtime seminar. Thank you, Sini, for arranging this, and of course other colleagues who are going to speak as well on this topic. I was first aware that the polio department is taking a step forward, a pioneering step on gender, is through the document that was sent by the polio department, highlighting about the efforts in polio eradication, explaining how that it is not at all gender blind. And I think that is a very concrete and very good document to begin with. And when we had the meeting, I suggested that perhaps it would be good to bring it to other parts of the house as well, and so other people can hear and learn from the polio department about the steps that they take, because it's seemingly apart from the work that we do, the GR team led by Veronica in gender, seemingly apart, but not at all. So I think this is a very very direct approach on how to showcase how both are really interlinked and connected with one another. Next slide. Well, the priorities of, if you want to do it mainstreaming, if you want to say it as mainstreaming, there are many different areas and steps that have already been taken in WHO, in this organization. I would like to highlight though the two of the top ones, which are the leadership and the UN SWAP. Slide. Okay. For the UN SWAP, or the system-wide action plan for gender equality and women empowerment, WHO is part of the UN-wide system action plan that has been ongoing and has been reporting on our progress on the indicator since 2012. And from 2012 to 2017, it was led by the GR department. And this year, it was, I lead the effort together with people in the business owners, mainly the GR and also other colleagues in the house, which are the PRP, HR, communications, the audit, and the DGO, of course. This WHO is part of the 66 UN countries, or 94%, that reports annually on the progress. And why is this important? Because the indicators under the UN SWAP is reporting on presenting as a dashboard that can provide us with a clear understanding, perhaps, about how our organization direct itself towards achieving gender mainstreaming and gender equality. It reports on financial tracking, how we communicate our leadership and our policy making, and the gender architecture. So there are these 17 indicators that we need to report on the SWAP. Next slide. what can we do? The swab then provides us with a clear indicator on areas where we are approaching requirement, where we are meeting requirement and exceeding requirement. The bold typeface are the areas where we can do better. We need equal representation of women across the 3 layers of the organization, systematic assessment, systematic capacity development, financial resource tracking and also allocation, and gender architecture within the program aspect and also the corporate aspect, and also to expand on the strategic plan, how it is the programmatic results can be better communicated in the strategic plan and also elsewhere beyond the strategic plan. Next step. Next slide. So what is the practical step that we can take on this is to compile and integrate every single work that this organization is doing with the relation on gender. So, for example, the effort from the Polio department should be connected with other efforts across the house. For example, in the TDR or under the health workforce, under the maternal and child health, and other reproductive health, and also other parts in which I believe Veronica will talk about the tools to help mainstream this, which is the work being spearheaded by GR. This approach is actually what you see on the slide is a very practical approach on how to compile and just to have a list and for everyone to see what is actually the different types of work that has already been done by our organization on the issue of gender mainstreaming. So we can respond better and really claim that WHO is transforming into a gender responsive organization. So it expands beyond just the number of women in the organization, but it stretches out and how the programs embrace gender lens and ensuring gender lens in its planning and also its resource allocation. At present, we are now working on creating a web landing page to compile all of this information as a place to compile this information and to showcase our progress and our vision towards this. It's not the end, but it's the pathway towards a clear claim of ourselves transforming into a gender responsive organization. So I think I will end at that and give it back to Kate.
Great, thank you. I wonder if there are, I think maybe the best way to organize this is to let the 3 presentations sort of move forward, because I think they kind of connect to each other. But if there were points of specific clarification that might be needed just now, sort of critical things, happy to entertain those. Nothing pressing. Okay. Otherwise, I think we'll move on to the next presentation. So Daniel, okay. I think you're next on the document.
All right. Thanks, and it's nice to be here. My name is Dan Walter. I'm the operations officer for the Polio department, and I'm standing in for Michelle Saffron, who truly regrets not being here. I don't think I can overstate how committed Michelle is to mainstreaming and increasing the profile of gender in the polio program. The progress that we've made is a consequence of his leadership and his passion, and these things are apparent in his attitude and his actions, and they permeate the staff and the program. But the polio program could not have made this journey alone, so I want to acknowledge the invaluable support that we've gotten from Dr. Magar and GER. And we've also benefited from the commitment of all of WHO's GPEI partners, and in particular, Akil Iyer from UNICEF, who's is their polio program director, and he is equally passionate and as much of a driver in his organization as Michelle is in his on this topic. So I guess my point here is that leadership matters, to set the tone, to set an example for others to follow, to be sincere, and to be relentless. And it's encouraging to see Dr. Tedros doing this organization-wide. Before I hand over to my colleague, Heather, who will give details about the specific place of gender in the polio program, I'll take a minute to cite a few specifics. I won't follow this slide chronologically, but I'll touch on the points that are up here in my brief remarks. We've heard, and we all know, how gender roles and norms are powerful determinants of health, and this is certainly true of the polio program. Therefore, the polio program regularly collects sex disaggregated data to enable it to track gender-related discrepancies and respond to them. The polio program has 4 indicators for measuring and tracking gender-related issues. These include measuring during each immunization campaign whether we are vaccinating boys and girls equally. Fortunately, recent data in these in the 3 endemic countries have shown that they are being equally reached, but it's nevertheless important that we have the means to continue to collect and to assess this data. Eradication depends on vaccinating all children, so if gender-related gaps appear in coverage, we need to be able to react to that. Another indicator is that we measure is the participation of women as frontline workers during immunization campaigns, and this, the participation of women has proven to be a success factor for the program. Female vaccinators are better able to get into homes and talk to mothers and ensure that every child is reached. The number of women vaccinators in Pakistan is now beyond 50% and still growing. UNICEF is expanding the number of community-based vaccinators to give the program a more permanent presence in communities where the virus is persisting and women have been shown to be most effective in this role. In Afghanistan, less than half of the frontline workers are women, and this may be a factor impeding progress, so we're looking aggressively at ways to increase female participation. This kind of information that I've just alluded to facilitates our reporting to donors who, as Kate mentioned and we saw in the presentation, increasingly insist on seeing evidence of gender embedded in our programs and its impact. There's no question that some of our donors have stayed with us through good times and bad, and over the long term, for decades in some cases, because of this. But I would say that our donor reporting is really a byproduct. Our aim is not just to satisfy donors. We mainstream gender because it produces positive results. Polio's work in gender is not only outward-facing. We don't just expect others to do it. We're examining our own attitudes and behaviors in the department that may be colored by gender considerations. We recently surveyed staff in the department to get baseline data, and Heather's going to talk about this in more detail in a moment. And during Global Goals Week in February, we have a half-day training plan to examine the results. For example, looking at unconscious biases that came out through the survey that influence the workplace environment and could interfere with our work. But this is just one example of what will be an ongoing and not just a one-off exercise. So, on Michelle's behalf, I want to reiterate the polio program's commitment to and passion for gender mainstreaming. This is a reflection of how we work as a team and what we do to achieve a polio-free world. Let me now introduce my colleague Heather, who will give us concrete examples of how gender considerations influence and make a positive difference in the work of the polio program. And thanks to everyone who has come out here today.
Thanks, Dan. I wasn't introduced, but I'm the lead within the polio department on gender, and why did it land in my lap is because it was actually a donor requirement, and I've been incredibly fortunate. I think Dan has spoken to Michelle's commitment, but I also want to speak to Dan's commitment and Veronica and her team. And really want to take the opportunity today to let you all know this is something that is so manageable and so doable. It's like, why aren't we all doing this? Because I don't have a PhD in gender. I have a passion for it, but I don't have a background in it. And I've been fortunate enough to have a resource like Sini, but also other resources within the partnership from UNICEF, as we spoke to earlier, but also the Bill and Melinda Gates Foundation, Rotary, the Center for Disease Control. So just building on all of the partners involved in this program, and even we're finding our expertise at country level that we have actually some of our staff have dual degrees in communications and gender, or they took some biological anthropology courses when they were getting their MDs, and so we're uncovering a lot of resources at our disposal. It's just right underneath our noses, and we didn't even know it. So we've kind of approached this through 3 different levels. We've looked at at an institutional level that we're making sure that we have specific strategies of gender in place, and most importantly that it's being incorporated into core polio activities. That we are having the adequate financial resources and human resources for gender expertise. So not only have we been fortunate to have a co-financed gender analyst, we've also established an informal gender network within the partnership so that we can call on our country and regional office colleagues as well. We have continued leadership commitment, not only within WHO, but within the partnership. And the other area is capacity building. So I've just gone through a 5-week UN Women training course on gender mainstreaming. It was online and in person. It was a wonderful, wonderful opportunity, and I would highly recommend that WHO staff take advantage of online training courses, not only at WHO on gender, but also through UN Women. And I think Rosamund has taken a course at the Turin University, UN University on gender. She may speak to that a little later. At a programmatic level, we're working to mainstream gender into our programming by ensuring that we conduct a basic gender analysis. The result of that is all available in a hard copy in the back of the room. We've developed a gender technical brief, and Dan had gone into the details about that analysis. That we monitor our gender sensitive indicators. We do that on a 6-monthly basis, and that's also available online. And that we ensure gender is integrated into all of our monitoring and reporting. So we do it not only at the global level in our semi-annual reports or annual reports, but also that it's being then reported to at a regional and at a country level through our technical advisory groups. We also are looking at participation in gender parity and what can we be doing better. Gender balance in the polio program is weak. We know that, and we are looking at ways to address this. Particularly, I think Dan had spoken to how we're, even at country level, looking at ways to increase participation in activities at ground level, but also bringing it all the way up, looking at the composition of our expert panels and advisory groups. We're thinking of new ways to recruit and promote more women in areas where they're underrepresented. A lot of this is about making things visible. So I think Dan spoke to earlier that data is really, really important, because unless you have the data, you can't make the case. So that was one of the first steps we took, and was going to be frankly honest, we had an intern in our department who was in between wrapping up her PhD dissertation and embarking on her career. And she had a PhD in biological anthropology when the issue of gender came on my desk, and I started talking to her, and she said, "Oh, why don't I start looking at all of your data?" And that's actually what got us on this journey. And I have to say it's been a wild ride over the last 2 years, with thanks to an intern for really starting to show how accessible all of this really is to the polio program. Yeah, having the data next. So I've spoken to the gender analyst that we did, and a lot of it was also about asking the right questions. So once you have the data, you really have to start unpacking it, and we're lucky that we have a lot of researchers on the polio team. We have a brand new biostatistician who helped us do, I don't know how many quality checks, I think 4 or 5 quality checks on our data, in addition to helping us make sure we're asking the right questions, and then having the GER team also look at some of the questions that we were asking ourselves as we unpacked the data. Next. Dan had mentioned that we actually, as another step in understanding the situation within the polio program, we conducted a large-scale baseline assessment of the GPI's gender responsiveness. This included a very large survey. It was online. It was across the GPI, so it wasn't just WHO. It was WHO, UNICEF, Rotary, CDC, and the Bill and Melinda Gates Foundation. It was in our key priority countries, as well as at regional and headquarter levels. We in total had 634 respondents. I think most importantly it was an anonymous survey, and that allowed some really amazing responses. I think it was a very, very, very well responded to. And it is forming the basis of a gender strategy that we will be finalizing in the course of this quarter. And we also did an analysis of our gender parity figures to really understand the current workforce gender balance. And then we took an analysis of all of our publications. As you know, WHO, we produce lots and lots of documents. So we take a look at all of our relevant, or what we consider relevant documents for the program, and did a gender analysis of the kind of documents that we're producing. And I think that's also, while polio is very operational, we looked at the operational aspect, what we're actually the service we're delivering, because we do deliver a service, but also we produce guidelines. And so we needed to look at that as well from a gender lens. How are we incorporating gender into our research, into the documents that we are producing? I'm not going to go through all the results of the survey. If you're very interested in them, please contact Sini and we can give you the results of the survey. We're happy to have coffee with you and talk about the results that came out of it. It shouldn't be a big surprise. Dan alluded to that we're going to be doing some training for senior management the first week of February, and that's actually a direct outcome of the survey results, that we now know some of the key areas that we need to address going forward. Next slide. So I've spoken to some of the steps that we've taken. We did the gender analysis that resulted in the technical brief. We looked at all of our sex disaggregated data, and we have room for improvement in this. I mean, there's always room to improve data collection, and we are the meisters of data collection in polio. And even then, we've discovered there are more areas. For example, missed children. We could probably be doing a better job at collecting and reporting missed children by gender. We've developed our 4 gender-sensitive indicators that we report on quite frequently. We've really upped our monitoring and reporting, and we've made all that monitoring and reporting very publicly accessible. We've developed supportive resources that's available to all of you. It's on our website, so we have some infographics, and there's also a handout in the back over there. We've developed a frequently asked questions page. We have key messages, so that anybody in the program could talk about gender, whether they're a communications partner or whether they're a team lead in one of our priority countries. Everybody has access to key messages. And we're just in the final stages of production of an animation video. Polio has produced several animation videos. They're actually award-winning that explain very sometimes difficult to grasp concepts, like a vaccine-derived polio virus or surveillance. So we've actually done one on gender, and they're done in such a way that they can be easily translated into several different languages, so that they then become a resource for our country colleagues. We can translate them in all kinds of dialects, with script at the bottom. And we've actually translated some of our animated videos into donor languages like Japanese or Korean. So we have, as I mentioned, the gender strategy that will be forthcoming. It will be for the entire GPI partnership, which is going to be based on the analysis, the data, our indicators, and the commitment of the leadership of the program. And continued commitment, I can't underscore enough that is kind of the make or break deal on this, is that if you don't have the commitment from the leadership, this will not move forward, and we're in a very fortunate situation that this is coming from the Director General himself. This is a priority area, and that has been our experience to date. I think I'm going to stop there and let Veronica have some time.
Heather, thank you so much for that. And apologies for me, I was so focused on I'm introducing Dan instead of Michelle.
No worries.
So that was fantastic. I bet there are a bunch of people here who are madly scribbling down sort of things that you've developed that we would think, how can we do that? How can we get that?
Yes,
so I have a funny feeling that you and Sini are maybe going to get swamped with a few emails after this.
Happy.
So fantastic. Veronica, I think you're on deck now. Tools for change.
Yes.
So over to you. And I'm going to apologize. I unfortunately have to step out to another meeting. So I think, who will I turn over the chairing to? Is that you, Sini?
Yes.
Okay. So if I have to step out, I'm sorry.
Okay. All right. Very good. Thank you very much for this. It's so wonderful to hear about gender mainstreaming from other people in that house. And thanks for the recognition to GER. Some of our best work, I think, is the work that's invisible behind the scenes, where we like to see others taking things forward. And especially about the language of gender is not just code for women, that it means everybody, right? And so here's an opportunity where we can really look at it, where we can look at sex differentials and really see where actually boys might be left behind. So I'd like to add some of the gender mainstreaming discussion that Diah talked about, that when we do gender mainstreaming, we don't do it in isolation from equity and human rights. We bring it together. So when we encourage people to do sex disaggregation, to also look at other equity stratifiers that are relevant and where there's data available to see the compounded effects. If you look at the state of inequality report on immunization that we did together with IER, you'll see where that was done, and there was some very important, interesting information that we can act on. So the other thing I wanted to mention about gender mainstreaming is that we have formed a gender equity rights network. We have focal points in the regions. We have focal points here, and where we.
Please keep going.
Okay.
Yeah, no, keep going.
Okay. So you'll see the next slide, this wonderful output, 4.2.6. We believe that this is the first of its kind where we're actually going to be measuring and monitoring equity, gender, and human rights over the course of the GPW in the program budget. So beware. And we will be working and collaborating with you closely on this. We're very excited. Along with the network, part of our gender mainstreaming or equity rights mainstreaming strategy is having a network that I just mentioned, and that people will be doing a self-assessment on their own. We will be accompanying with them, and they'll be able to score, and you will be seeing the different indicators in a minute. And then developing an action plan to be able to make a shift on that score. But before I go to the next slide, I wanted to mention a few shifts that we're undertaking organizationally. That's been a little bit contested over time, and we're moving in that direction. And one is that under the rubric of leaving no one behind, we're looking also at gender, as I said, as it intersects with other inequities. We're also looking at men and boys and masculinities. We're also looking at gender diverse populations, and we're looking at women and men as both users and providers of care. So onwards with the next slide. So this is the equity gender criteria and monitoring project, and actually we have two people here that could give you an earful. They're the leaders of this, and they should be actually the ones talking about this. That's Gerardo and Katie. So please introduce yourselves to them after this. But very briefly, there's, as you can see, 4 layers to this. First is evidence and analysis, knowing who's being missed. That's through the data disaggregation work, and we have a lot of modules and training. And actually, Ahmed Hosenpour is not here in the IER department, or I think it's HMM department now, leads this work and has created this work. And then the next one, I'll be giving you a little bit more detail, is analyzing who is being missed at a granular level. Why are these, what are the barriers? And then acting on those barriers, what are some actions? What can we prioritize those to be? And the fourth one, in a participatory way. And then what are the accountability measures? Is this in our people's PMDSs? Is this in the director's PMDS? And then management, capacity building. Have we been doing capacity building or engaged in capacity building opportunities? And are we earmarking funding? So next slide. This is the country support package. I'll go over briefly. There's 4 elements to it. You'll see on the 4th, what I mentioned earlier on data disaggregation, we have tools called HEAT and HEAT Plus that you could use at the national and sub-national level. You can upload any data. The barrier assessment, which I'll go in a little bit more detail in a minute. Then the second one on the right, that's more health system oriented, so I won't go into deep detail of that. But on the bottom left, you'll see Innovate, in which there's an 8-step-wise process for the Ministry of Health to lead a process of, once you look at the diagnostics and the data that's there, working with the ministry and other sectors and NGOs, civil society, to actually identify priorities and actions that can be taken, and integrating it then into the monitoring process and the strategic development process. We also have a gender mainstreaming tool that we use often in collaboration or alone with Innovate. And then you'll see on the right, these are the actions. You'll see the equity gender rights criteria that I just mentioned, and then other capacity building actions that we recommend. Okay, next slide. So now I want to focus a little bit on the barrier assessment tool. AHSBA stands for Adolescent Health Systems Barrier Assessment Pilots. Can you just keep pressing just enter, you'll see things come up. These are really relevant to what we saw with adolescents. So you can extrapolate maybe what you would find. We haven't done it yet, or with immunization or with polio. We would love to work with you on this. But we use the Tanahashi framework, and you'll see on the left, this is a health systems framework to really focus on effective coverage. And this is, I think, super relevant to polio and immunizations. What is that last 5-10%? How can we reach those? And you really need to often go at the most granular level to look and really dig. In the barrier assessment, we look at the supply side from the health system and from the demand side. We use both quantitative and qualitative analysis to really get at that. And so you can see, like for neglected tropical diseases, when we did this, we saw that women weren't accepting prophylactic chemotherapy from men. We saw that there was issues around with herder discrimination related to herders. We saw that children weren't accessing medicine because a few children died, and the teachers who were dispensing thought that they had something to do with the deaths, so they stopped. So it's that granular level that we need to get at when we're reaching the last 5%. And so we encourage, if there's space, to consider using, at least testing the tools, maybe 1 or 2 districts. Okay, that's just about all I have to say. And I think you can go to the next slide and see the thank you slide.
Thank you.
Thank you so much, Veronica, for that very useful introduction into the tools that are available for all the units. We're now going to move on to the Q&A section. So we want to keep it a very informal discussion. So if you have even any comments you want to share, any experiences that you have from gender mainstreaming, any questions that came up from this presentation, so please, and then if you can, to use the mic. So we're trying to record it so we get the best possible audio.
Hi, Richard Spolsky from the Health Metrics. Just to say that this year the World Health Statistics, which the Health Metrics unit prepares, is going to have a focus on gender and is going to try and look at sex disaggregation of all the SDGs that we report on. So that is underway now. I'm going to be working with Veronica and Diah and others. So actually, I was not previously aware of what you were doing in polio, so we will be knocking on your door.
Happy to oblige.
Thank you. And then before, if you can always just introduce which department you're from and your name, that would be good. Yes, please.
Hello, everyone. I'm April. I'm with the Immunization department here in WHO, but previously with polio. And I would like to really thank my colleagues in polio for organizing this and bringing everyone together. I think this is a great opportunity. So I have two questions. One maybe a corporate WHO question and one specific to the polio program. So in my previous life, before WHO, I worked on gender mainstreaming issues, and what we faced were two specific challenges. One was about management and administration of it. I mean, both Kate and Veronica, you mentioned that this is not about women, but when you actually look at around the room and how many men we have in the room versus the women, and how many women are interested in this issue versus men, I mean, that is still a challenge. And the UN system have come up with some options, like he for she, for instance, is an example of this. Like, how do we make men talk about this rather than women? How do we look at this more like are we taking this seriously, or are we trying to tick a box? And in many organizations, this is more like a tick-the-box exercise because of the donor push. So, get a little bit of sense of whether you're facing the same challenges and how you're addressing it at WHO. And more from the program side to Heather and Sini maybe mostly. The examples I've had, like working with the countries in particular, where gender is seen differently by different countries. In the conversations, especially with the governments and the national authorities, how do you make sure that this doesn't come across as a donor agenda? And, it's one thing using the indicators, setting baselines, but when you're actually trying to move, this may become controversial, especially with certain indicators and for certain issues. And again, how do you strike that balance between pleasing the donor and, do the donor reporting, but also taking into account the country realities? Thank you.
I don't know if Veronica, you want to speak to the first question?
Okay. No, happy to. Yeah, I mean, maybe the men could answer why they would feel that maybe other men, and we applaud the men that are actually in the room. I mean, I think we really need to, we're really, as Kate was saying, and I think the way GER is moving, is that we need to engage men. And I think he for she is a big part of it, but also he for he. And he for we, it's, and I have seen again and again and again in my own practice before I came to WHO, when you start engaging with men on how gender affects them, how they, like when in Bangladesh, Violence Against Women program, working with imams, when they saw how gender and roles and norms were affecting them, that they couldn't, as poor men and minority men in the community, couldn't bring in the kind of income that they had expected for themselves, and how they were experiencing gender as both privilege but also as a burden, they were able to make the connections with women and girls. It was really, really so evident. I saw that time and time again. So I think we need to look at gender and really start exploring some of these areas while not forgetting that women and girls are just often disproportionately affected. And I think we're going to see with the gender statistics is that actually the burden of diseases and morbidity, mortality is lying pretty heavily on men. Mm-hmm. So time to start reckoning.
Just on that comment, 'cause I'm going to have on that comment about why men are not interested. I previously was doing malaria and never been interested in gender before because it's kids that actually affects boys and girls more or less equally. Pregnant women, yeah, but also men outside. So I take your point about not having to be a specialist. And I have to admit, having started doing the World Health Statistics and looking at a range of diseases through a gender lens or a sex differences lens, I mean, it is fascinating. I would agree. Generally, the statistics are showing that men in many areas are worse off. However, when you look at a lot of the publications and the UN points of view, they completely ignore that. I read this morning, more women die from heart disease than men. That's not true. Rheumatic heart disease, it is true. Ischemic heart disease, it's totally false. And those things are being propounded all over the place. And we need to really focus on the evidence. Now, there is a difference between men and women. Actually, the difference is bigger in richer countries. If you look at the difference in life expectancy, it's the high-income countries, it's in the older age groups that it's more important. Go to low-income countries, the difference between men and women is actually less. The things that women are dying from, maternal deaths, the cervical cancer, they're easily preventable. And that's the kind of difference and the things that we need to really bring out when we're doing programs is what are the important factors to think about. In lower income countries, it's actually basic access to health services, both for men and women, but women are disproportionately affected. In the higher income countries, it's more behavioural. Everybody's got access to services. Not everybody, but, women do not die from maternal deaths in high-income countries unless there's a really extraordinary situation. But they do, but the difference is people are dying more from ischemic heart disease, cancers, etc., which are brought about by behavioural differences and often more by men. But increasingly, actually, as women get more power over resources, they smoke more, they drink more, etc. as well. So you're catching up. So there's a whole range of things that are going on, but you look at what's out there, it's not,
yes,
nobody
exactly.
talks about it.
Yeah, thank you. It's a lot about, exactly as you pointed out, using the right kind of lens. When you're switching on your gender lens, looking at it, you discover a lot of issues that you might not have been aware of before. Maybe, Ibru, you had the second question, which I think was a really good one, about, when we're working with countries, how do we avoid this, seeming as it's something that only comes from the donors, we're just ticking a box and doing it because somebody is making us do it. I think in this one, the way it's very important to frame it is in terms of program effectiveness also. And it's about asking the kind of right questions. So whatever health program that you're working with is essentially about asking the right questions. Are there differences in terms of the resources that men and women would have access to in a particular context? Access to information, what are the differences there? Different kind of resources, for example, getting to the clinic, decision-making power in the household around vaccines, for example. So there are many, many ways to look at it, just asking the right questions and kind of drawing that link with the program effectiveness. In this case, how is it that we're able to reach more children with the life-saving vaccines? So in terms of to try to avoid it being seeming something that only donors are pushing and we're just doing it to tick a box, and something that it doesn't seem very threatening to even start to implement. Really what it is about is making sure that we are equally reaching men and women, boys and girls with our programming and making sure that we get these services to everyone. So I think that often helps a lot when you frame it in terms of the effectiveness and reach. I don't know if you want to add something to it.
I think one of the things, of course, we work in some of the most difficult places in the world, and we have had to be careful about the language we use and maybe not labeling things that you might see in a typical report to a donor. And so I think that helps overcome some of those issues, because ultimately most of the governments, they want to reach every last child. That is their goal, to end this horrible disease. And so we've just really worked hard to make sure that we find language that's appropriate, because women's empowerment, if you translate that just as a non-starter, for example, in Afghanistan, but we found other words to use and other language to show the important role that women have to make sure that the child is accessing, receives the vaccine, whether that's in partnership with her husband or other ways. So I think, too, overcoming language can sometimes we get so hung up on some of these terms. It's really not about the term. It's really about how are we accessing the children. So. Yes, please.
Oh, hi, I'm Helen Matzker, also on the EPI team. So thank you. It was really great to hear kind of the landscape of all the different areas and where gender is being reviewed and looked at. I guess my question is around some of the monitoring and evaluation you're doing on all the different levels where you're working on gender, because that the discussion from the polio team on the percentage of health workers, frontline health workers, and leading to increased coverage. But it seems like that has to happen at all the different levels. So how are we going to actually monitor the impact of the work that's being doing? And so that's more, the what is very clear, but the how we're going to look at it and do it is a little less clear. So, thank you.
Well, I think the polio program has, and we have our slide here so we can speak to our monitoring and evaluation systems are incredible, and I think there's a lot of lessons to be learned from that and how we collect our data and how we analyze it. We did have some pushback from the country teams about, for example, changing the vaccination forms when they're doing campaigns to say how many girls and how many boys. But the initial kickback was, we don't want to do this, it's one more thing they have to add. But then actually it was like, yes, but you need to be reaching all the children and you need to understand your local communities. And so, you have to have the conversation a few times because it is hard to change things, especially like the polio program. Everybody's had the same form for the last 20 years and nobody wants to change it, but change can happen. But it's just little things like that just a simple form that folks are using at country level. And then how we have, massive data systems. We've had to make sure that our current data systems allow us to now have sex, male, female, as we start to go into how many children do we actually vaccinate, and making sure that we can break that down and record those in our systems. So it's something that we're constantly having to, it'll evolve as we get more sophisticated and sex disaggregating our data.
Definitely. I think one important issue is also what was mentioned earlier. We're developing a gender strategy specific for the polio program GPI. With that gender strategy, we'll have specific action plans with indicators and a mini monitoring evaluation framework together with it. So we'll definitely make sure that we have a solid M&E built around the implementation of the gender strategy. Obviously, it's very important for tracking.
And I'm not concerned about I know the polio has so much data, but I think there's other levels of the organization that are doing some of so how do you also monitor the work? No, it's fine. I mean, I know you have so much data.
I'm just so excited about what we're doing.
So are you talking to me?
Yes. Yes.
I'd love to get out of the way. So you're asking how we will monitor.
How you monitor the impact of the policy and the changes that you're doing that there's actually...
I'm going to let Veronica answer that. If you want to.
Yeah. Okay, so I think it's a great question, and let me say why. First, congratulations, this is a great seminar. So our team is tasked with mainstreaming equity, gender, and human rights in the organization, and we've been doing that for many years since it was set. But the mandate has not been accompanied by mandatory mainstreaming. So programs have been doing this on a voluntary basis. Some programs are more advanced than others, and some programs are very reluctant because of many reasons. Then, once we do our work, we don't have the mandate to actually monitor that. We've been working closely with PRP in improving the regular monitoring and reporting systems of the organization. So we provide inputs to the midterm review and the end of the review, and there are sections there to report on how programs mainstream equity and human rights. Up to now, this reporting has been narrative. It's just an overall assessment of what's been done. And the problem with narratives is that you have to extract and aggregate all these tests, and that's not very comparable. What we are going to do now in the next PB, fingers crossed, is based on the output, on the new output that we have, 4.2.6, that clearly indicates that mainstreaming of equity, gender, human rights is a common share of all programs. And therefore, we need to make sure that we're going to be able to do that. And that's what Veronica presented earlier, the so-called EGR criteria, with 8 criteria to mainstream across the program, that will be accompanied by a scorecard with a rating system. And that will allow us to actually see how programs are performing. It's not going to be a police-oriented system. It's more of a self-assessment approach to actually identify what gaps exist and what we need to do and what kind of support we need to provide to programs. So this is just the criteria, but Veronica came up, the scorecard takes 5 pages. For each criteria, we have a rating system that is aligned with the UN SWOT. So that is also another level of coherence in the UN level, and we are working very well with PRP in introducing this in the reporting system. Not this year, the next week.
Great, thank you so much. There's a question there, please.
Hi. As a brown woman, I have to ask this question. Have you thought about how our understanding of gender equality might be in conflict with cultural identities of some of the countries that you're dealing with? And how will you stop gender mainstreaming, particularly at WHO, be anything less than, token NGO feminism, which we have seen time and time again to advance an imperial agenda, like in the case of war in Afghanistan. One of the reasons cited time and time again by Laura Bush was that we're doing this to free women or to make women more empowered. So how do you stop yourself from falling within the trap of being an NGO feminist?
Thank you so much. That is a very good question. That is one of the big criticisms often when we're talking about gender mainstreaming and gender, that it's kind of a Western concept or we're imposing it on other countries. But that, if you're looking at it closer, it's really not the case. Whatever culture you're working with, first of all, culture is never a static thing. It's something that is always fluid and changing. And all culture have concepts of, equal treatment, whether it's phrased in different ways. And I've worked in Afghanistan for 5 years and worked closely with the women's movements there and different NGOs. And definitely there, we often tend to paint this picture of Afghanistan as if, there is no concept of gender equality there. But then when you actually start working, especially if you're working with the women and listening to their voices and hearing what they have to say and what are their priorities, and for example, in terms of polio vaccination, that how they would prefer the vaccine to be delivered to them and their children, what would they need in the health centers in order to have better access and availability for health services for them. So I think a lot of the times it's also the question of who speaks, so who is marginalized, who gets to have their voice heard and about their needs and their priorities and specific challenges and vulnerabilities. So that's definitely a criticism that we often get, that it's kind of a Western concept, but it really isn't. So if you're working, especially more on the grassroots level, and really hearing from the people that we're serving, what is it that they need, so then you would see a similar kind of concepts. There are often, of course, gender mainstreaming is a very technical concept. Gender, we use it as a very kind of abstract concept, but the actual thing that what it refers to and what it's meant to do in terms of equality and access to services, that's something quite universal everywhere. If you want to add.
I can just add to that. I think that was really, and thanks for raising it, because I think it's really relevant in my own country that I know well. You cannot separate gender from race. For the whole history that we have of slavery, and we can go into that. So I think that this is a feminist theory around intersectionality, that you really need to look at the intersections with all inequalities. And as Sini was saying, you really need to work contextually with women and men, boys and girls on this, and let them lead the understanding around this, and that gender mainstreaming can come across a technocratic. If you're working in a huge institution, you need to be able to monitor, but also be critical of this, how we're using this. And gender mainstreaming can become depoliticized. But I think it's engaging with civil societies. I don't know, I'm not sure what you mean by feminist NGOs, but the kind of... What's that?
It's a whole term that's used for NGOs that use women empowerment as a tool to advance, more Western or imperialistic ideologies.
Right. And so really, it's not just about women gender equality and empowerment, but looking at roles, norms, relationships with women and men, with their fathers, brothers, sons, so forth, but also their employers and the state. And so looking at kind of problematizing it and then looking at underneath the complexities. Anyways, we could go on, but
Thank you very much. Are there any other questions or comments? Yes, please.
Thank you. I'm Gaurav from Gavi, the Vaccine Alliance, and I'm actually also on the gender working group in the Secretariat, so very happy to be here, and this is really fantastic, so congratulations for all the work. So Gavi is going through a process of the gender policy evaluation, so I think it'll be really good to connect on some of the thinking, some of the new approaches and the tools, because obviously a lot of work is happening on the polio eradication side, but I think it's increasingly important and evident that needs to feed into the routine immunization side of things, a point that we've mentioned as well. The second aspect is that on the SDG 3 Global Action Plan, which was presented in Berlin, it does have very strong language and clear articulation around addressing gender-related barriers to access to health services. Now, as that plan develops in 2019, I would also suggest that some of the work and the thinking that's happening feeds into that further development of the Global Action Plan. Because essentially the idea really is that the Global Action Plan is in support of countries to achieve the SDG 3 goals and targets. So I think we would probably be doing a bit of a disservice if all the great work that's happening just gets restricted to the polio program within WHO and beyond. Thank you.
Thank you very much for that. I think we have time for one more question or comment if anyone has anything they would like to share before we wrap up.
I want to call on Rosamund. I want you to talk about your training, because I think for those who are passionate about this but don't have a PhD in gender, there's so many opportunities. WHO actually has a study lead policy and staff development policy that's actually quite wonderful and generous, so you should take advantage of it. And I've done so, but I'd like maybe Rosamund to talk about her training that she went through.
Sure, thanks very much. First, I want to congratulate the organizers of this session. I think it's really brought together both this kind of macro theoretical level, what's happening at the organization with concrete frontline experiences and lessons learned, and it's that kind of cycle or iteration that makes it more meaningful to different people in the room at any one time. And I think that's really super, and I'd like to see more of this. So first of all, congratulations to you for that. For the training that I attended, it's at the United Nations campus, which I didn't know existed. Despite being in WHO for many, many years. So there is a staff college at Turin, Italy, and the training that I attended was a 5-day training called Women, UN and Leadership, or Leadership Women in the UN. That's it, Leadership Women in the UN. It's a training that's been offered a number of times already. It comes to Geneva a couple of times a year. It's targeted for mostly women. Actually, all the staff were women. All the participants were women, and the staff were all women except one quite extraordinary gentleman from Lausanne, Switzerland, which just was, he was very good, but also there to show that this is not only an issue of women or for women. But the training was really an eye-opener because it did a number of things. One, there's the whole theoretical aspect. So yes, there are people who have PhDs in this. And it is an entire area of work and knowledge and research and discourse in its own right. And so when gender is dismissed as it's a women's issue, or we've heard a number of other perspectives here around the table which are really important, because it's not just a women's issue. That was the first message. The second thing is that it's very much intertwined, not only with culture, as you've outlined here, but with biases of all kinds, whether it's age, whether it's race, whether it's east or west or north or south or whatever background or experience you have, technical, non-technical. And so all of these different parts of our experience, our individual and collective experiences, make up who we are and also influence how we behave. And another part of the course, and so therefore we have, we generate, we may live with, all of us, certain biases of which we are also completely unaware. Whether you're a man or a woman, your background brings you certain experiences through which you see the world. And it was really also an eye-opener because you could realize that it's not just experiences that are personal, but people don't even realize how they're behaving. And when you have experiences of people around you in your own workplace, for example, sometimes they may be discouraging, but in fact, certain things may just not be. So this training that you're doing in February, for example, is a very good next step forward for a different aspect of gender, which hasn't come up here yet today, which is gender experiences or bias in the workplace, or culture bias in the workplace, or different, which is different from what's happening at the front line, but for an organization like WHO, I would posit that it's at least as important because it's the organization, it's the staff that's trying to actually change the rest of the world, and so we also need to start by changing ourselves. I think another aspect of it which was really useful was for UN women, so that's what I'm mostly speaking to in this room, but also our colleagues, men colleagues, is that there is quite a difference through your career experience. So at the younger generations now, I'm seeing a lot more women coming into entry-level posts. At the upper level, the DG has made sure that at least half of the senior management staff are women, and so we're having this experience. There is still the sandwich generation in the middle. There's a sandwich generation of women in their 40s and 50s who don't have the political support and who don't have the kind of natural movement of society towards more equity based in certain societies, including at WHO and the UN in general. So the organization and the UN in general still has work to do for middle management, which is another important takeaway because that applies to middle management in Pakistan, in Nigeria, everywhere, not just middle management at headquarters. So adding that to your basket of lenses through which you can look at the program, I think would be really important. And the final thing that was really, well, there's a number of other things that useful about the program, so I'll sell it to anyone anytime. But the other thing is that the language that it provides, when you can name something, it helps you cope with it, whatever it is. And so by having these very experienced researchers, as well as counselors and coaches and so on, all playing a role in this 5-day training, you come out with a new language that allows you to discourse and allows you to understand and integrate both new concepts as well as experiences. So if anybody wants to know more, I highly recommend it.
Thank you so much for sharing. I guess I'll hand it over to Dan for closing remarks.
Okay. There was a whole lot that came out of the discussions, and that was very helpful. And I don't think I need to. Well, I could highlight a few points, but I think it would be good if we could identify a few takeaways. What happens next? Is this a way to spend our lunch hour, or is there something that's going to follow up on that? So I'll ask for your input on that when I'm finished. Key points. Gender mainstream is a UN value, and WHO is accountable to deliver on this. It's also increasingly a donor requirement, but that's not what should drive our work in this area. We need data to make the case and produce evidence in this area. Polio has information, has a lot of information, has data, and it's publicly accessible. It's accessible to everybody, so if other programs start on this journey, they don't have to start from ground zero, but they should take advantage of what's already available. Our program, at the center that applies to many, is not and cannot be gender blind. So it is a factor, and I think we heard elsewhere that it's an important lens to view. It's an enlightening lens to view things through. There's a lot of discussion, and I think this point can't be emphasized enough, that gender does not equal women. It's not the same thing; those are not synonymous, and so we have to make sure that people understand that, and also that it is equally relevant to men as to women. There was the point made by our malaria colleague about all the insightful information that came out about health that will certainly should or could potentially draw men into this discussion more deeply. Let's see. It was interesting that what you said about gender mainstream or gender equity and human rights being voluntary. So how do you get people to play if something's voluntary? It's important. It's emphasized. There's going to be measurements against it, but there's no mandate. So we need to do something about that. I think I'll just close with Rosamund's inspired summary of the course she took. I think it's been a while now, but it's still very much with you. So maybe that can be a topic of another lunchtime seminar, but I think you're going to get a lot of interest in attending that course. So I will stop there. Those are a few points, not all of them. Everybody's going to take away different stuff, but I hope all of us take away something from this. Do we want to, well, I will ask, is there any follow-up actions people would like to propose? Yes.
So I'd like to pick up on something that our colleague from Gavi talked about. I think we're at a stage in the polio program. The closer we move polio to immunization and immunization to polio, the better. And my proposal would be I know how Michelle is committed to this issue at the leadership level. There is a lot of work going on in Gavi and a lot of commitment as well on the immunization front. And Kate was here from our side. So I think maybe an action point for us could be how the two departments can follow this up. We are glad to hear that GPI will be coming up with a gender strategy. You have a lot of data on baseline. We have a lot of data on gender desegregation. How do we kind of bring this together and use this collectively? Maybe that's something that we as two departments can follow up with our leaders, Kate and Michelle, and see how this goes forward, involving Gabi as well.
That's actually what Kate whispered on her way out the door.
Great.
That she was so excited and really looks forward to collaboration and the need to do this.
Veronica?
No, I think onward, we look forward to working with everyone, and I think immunizations and polio are so well positioned because you are really working and focusing on those last 5 years. We're very target oriented, so I think there's a lot of potential and possibilities to really look at the why barriers and the rest of the organization can learn quite a bit. So
yeah, I forgot to mention the points that what you said about the data you have on when programs reach the end, and we're trying to get over that last hurdle, and that's the kind of information we're looking for to inform what we do now. We've gone as far as we can go with what we know, so what don't we know, and what fresh approaches can we take, and that could be the kind of information that we're looking for.
I'd love to work with you on that.
Okay. Alicia's on the verge.
Oh,
okay, all right.
Thank you.
Thank you.
Let's be in touch with you can also respond to the